Hi everyone, I am Dr. Kylie Fuller, a board certified OBGYN. Today, I want to talk to you about an important question that does come up all the time towards the end of pregnancy. When should I go to the hospital? One of the most common things I hear from patients is, I don't want to overreact, or I don't want to bother the staff at the hospital. And I want to say this clearly, you are never bothering us. If something feels off, we want to know. Pregnancy comes with a lot of changes, and many symptoms are safe to monitor at home, but there are certain situations where it is always better to be evaluated. With most of these concerns, there is no way to know for sure over the phone or messaging. So, my recommendation is almost always go to your nearest hospital. You can always call or message your provider, but generally we can't tell without evaluating you and the baby. Let's start it off. Light spotting in the third trimester of pregnancy can happen and often is part of the normal latent labor course. However, if you're having heavier bleeding like a period, passing clots, or bleeding along with cramping or abdominal pain, then that's something that you should immediately be evaluated for. This does not necessarily mean that something is horribly wrong, but it should urge you to be seen. Mild cramping and stretching of the uterus and inside your abdomen can also be normal as the body changes. However, severe abdominal pain, sharp, unrelenting pain in the middle or on one of the sides, or pain that does not improve with rest is not something to ignore. If the pain feels intense or unusual for you, it's worth being seen for. Next, if you notice a sudden gush of fluid or constant leaking sensation, especially in the third trimester, this could mean your water has broken. Sometimes it's obvious, like the movies, but sometimes it's more subtle. But if you're unsure, you'll notice a theme. Go be seen. We would much rather check you out, reassure you, and send you home than have you or your baby at risk for infection or sepsis from prolonged rupture of your membranes. Another important reason to call is if you develop a severe headache that doesn't go away with rest, hydration, or Tylenol, blurry vision, seeing spots, pain in the upper right quadrant, sometimes with new swelling in your face or hands. You guessed it, these are symptoms of preeclampsia and should be evaluated promptly. After about 24 to 28 weeks, you'll start to recognize your baby's movement patterns. If you notice a significant decrease in movement or something just feels different than the normal pattern, you know your baby best. Please go in and be seen. Although it does seem easier to come into the office and us listen to the baby's heart rate really fast than go to the hospital, our office in particular is not equipped with something called an NST machine or non-stress test. These are small devices that will be placed on the outside of your belly and then will monitor the pattern of the baby's heartbeat over a period of time. This pattern is actually the most important workup you can do to make sure the baby's doing okay. You should also call, message, or go straight to urgent care if you develop a fever over 104 degrees, have painful urination, persistent vomiting where you can't keep fluids down, or just feel generally unwell. Infections during pregnancy are important to address quickly. The most important thing to remember is this: if you're unsure, go be seen. It may mean an extra trip to your hospital or labor and delivery, but we would always rather answer your questions and reassure you than have you sitting at home with something being wrong or just have you worried. Pregnancy can feel overwhelming at times, or all the time. But you're not alone. Your healthcare team is here to support you every step of the way. If you found this helpful, please be sure to subscribe for more pregnancy and women's health related content. See you in the office.